Hi everyone, welcome back to your channel I Love Pharmacology. In this session, let us understand edrophonium. Myself, Dr. Padmanabha, DS. Edrophonium is a reversible inhibitor of acetylcholine esterase. So these drugs will going to increase the acetylcholine levels by inhibiting the acetylcholine esterase enzyme which is required for breakdown of the acetylcholine. So in case of edrophonium test, you need to give a 2 milligram of edrophonium rapid IV injection and see for the response. If there is no response after 45 seconds, you need to give a additional 8 milligrams of edrophonium and then you're going to see either the positive response or the negative response. So in case of positive response means the individual muscle strength will improve. That is the sign or indication of diagnosing myasthenia gravis, where the patient will be having poor muscle strength or muscle strength will be reduced. So these edrophonium will increase the acetylcholine levels and it will going to increase the acetylcholine binding to the acetylcholine receptors. So what happens in case of negative response? In case of negative response, the patient will not respond and muscle strength will become worsen or muscle will become weak. So this is the sign or indication of cholinergic crisis. So whenever there is an increased acetylcholine, there will be a depolarization of the motor end plates due to the excessive acetylcholine, which leads to the blockade on the motor end plates. That leads to decrease in the muscle contraction, leading to the muscle weakness. So if the response after edrophonium test is to improve the muscle strength, that indicates the patient has got myasthenia gravis. If the response is to weaken the muscle after administration, that indicates that the individual has cholinergic crisis. If the individual has got cholinergic crisis, you need to stop or reduce the acetylcholinesterase inhibitors. Whereas in case of myasthenia gravis, you need to go with the acetylcholinesterase inhibitors. So why it is chosen for diagnosing myasthenia gravis and cholinergic crisis? Because of their brief duration of action and also it has got rapid renal elimination. So nowadays what they do is to establish the diagnosis, they go for detection of the anti-receptor antibodies by taking a muscle biopsy or from the plasma. So what is the other name for edrophonium test? It is also called as tensilon test.